Thank you everyone for joining us. We have a couple announcements as everyone gets logged in. First, you'll notice that this session allows you to have your cameras and mics on. We just ask that you follow our presenter's lead on when to do so, if you're invited to do so. And next, if you'd like to ask a question during the session, please make sure and use the Q&A area to the right of the viewing window. I think we are all ready to get started, so I am going to welcome our speakers, Josh, Nipa, and Scott, and pass it over to Josh to get us started.
Thanks so much, Sama, and good morning, good afternoon to all of you joining us. Thank you so much for attending. This session is Closing the Gap in Improving Outcomes, Identifying and Addressing Veteran Food Insecurity. My name is Josh Protas. I'm the Vice President of Public Policy at MAZON, a Jewish Response to Hunger. Pleased to welcome you, and I'm going to ask our other panelists, who are our all-star panelists, to introduce themselves in just a minute. I want to set the stage for a bit, because many of you who are attending this session have probably seen more in the news recently about veteran food insecurity, and it's been very gratifying to see more public awareness and attention on this issue, but it's not a new issue. Veteran food insecurity has existed for a while, and unfortunately has long been overlooked, both by policymakers, by advocates, and by our federal agencies in some ways. Thankfully, there's greater attention that's been paid to veteran food insecurity, more academic studies that have been done, more data that's being collected, and so there's a better understanding about some of the unique challenges within the veteran population, a recognition that the veteran population is not monolithic, that there are different parts of the veteran population that are different from one another. And so when we look at food insecurity issues for veterans, want to be thoughtful about strategies, about policies, about practices that can really best meet veterans where they are and make sure that we're connecting them with available resources. One recent study showed that of veterans who are food insecure and potentially eligible for SNAP, only about 1 in 3 are actually participating in the program. That's very, very concerning. That gap of 2/3 of veterans who could be receiving help from SNAP and are not participating means that we have a lot of work to do to help close that gap and make sure that we're fully addressing the issues of veteran food insecurity with the available resources, and doing so in thoughtful, effective, and strategic ways. So I'm pleased to turn it over to Scott Carter, my esteemed colleague at USDA, who will introduce himself, and again, welcome.
Thanks so much, Josh, and appreciate that nice welcome. Thank you so much. And let me just also thank all the attendees for joining, and certainly for the Alliance to End Hunger for the opportunity and the leadership, as Josh mentioned, in holding this session. I am a veteran. My wife's a veteran. And been working at USDA since 2007, and for many years working very closely with Josh and MAZON and many others on this issue. It is a challenge, as Josh said, but in addition, as he said, I think we're starting to get a little bit of attention to this issue, so it's great. We're seeing more research. I know my colleagues, Nipa is going to have some great information to share. I know my colleagues at ERS are looking at the issue on veterans food insecurity. So it's good to see the issue brought up, because leadership matters when you're dealing with issues such as this. We have to address it head on. We know there are challenges working in our veterans community, unfortunately, with homeless and some of the other challenges that many of them had due to combat and other activities. So I really appreciate that, and look forward to hearing your questions. We want to hear your dialogues, and thank you so much for joining us today. And let me turn it over to my colleague, Nipa Kamdar, and thank you so much.
Thank you, Scott. So as Scott said, my name is Nipa Kamdar. I am a nurse practitioner by training, and I work at the Houston VA as a researcher. Most of my research is using qualitative approaches, which means that I meet my veterans out in the community, and we talk about what their life experiences are with food insecurity. Statistics are good, knowing those experiences and the struggles from a first-hand point of view is also very important. So on that note, I'm going to go ahead and start sharing my screen and start a short presentation before we start our discussion. So there's our title and our names again. Just in general, food insecurity affects about 11% of veterans. Veterans of more recent service eras, such as those that fought in Operation Enduring Freedom and Operation Iraqi Freedom, are at greater risk compared to more distant service eras like Vietnam or prior to Vietnam. Compared to non-veterans who share similar sociodemographics, veterans are almost 3 times more likely to experience very low food security. And in case you don't know, very low food security is that one associated with reducing food intake or skipping meals. Among those veterans who have very low food security, their risk for depression and suicidal ideation increases. Those who have very low food security actually have a 4 times increase in odds of experiencing suicidal ideation. Screening for food insecurity is one method of identifying veterans early on. In October of 2018, the VHA added screening for food insecurity into their electronic medical records in primary care clinics. And more recently, we switched to using the hunger vital sign as a screening tool. Those veterans who screen positive are offered a social work consultation along with a dietitian consultation. There are a number of federal programs that can assess veterans who are food insecure. Among those are SNAP, WIC, and Meals on Wheels. And there's lots of opportunities to continue to address and make changes to improve their access to these programs administratively, regulatorily, and legislatively. And I believe Scott's going to be speaking more to those. There's also a number of community-based initiatives. In our local communities, there's often food distributions and food pantries that veterans are referred to. Some of these pictures that you see in these slideshows were taken by veterans who I've interacted with. And this particular food pantry is one that was created by a veteran student services director to be right below the Veteran Service Office. But there are continued gaps that need to be addressed. So this is a rather busy slide, and I'm not going to spend as much time as I wish to. But basically, when we're looking at getting food to the table in the veteran household, there's 3 main things we got to consider. One of them is the obvious one: resources, income, time, transportation. The other one is personal capacity, which includes the veteran's physical and mental wellness. And then the third one is the military culture. There's often a military ethos of making do with what we've got that we've got to work with veterans on to ensure that they're getting what they need and that they deserve to have access to food. This is just a quote from one of the veterans that I interact with regarding that veteran culture. So he said, "I can speak for myself, and it could be the same for other veterans, but for the big part, we adopt a military structure. We kind of feel independent and don't need to step outside for help or support. I wouldn't go for resources that are free or immediately available. So in some cases, the way we approach helping veterans needs to be tailored to fit within their culture." The other aspect of treating veterans who are food insecure includes, of course, integration with mental health care services. So that has a high effect on whether or not a veteran is going to be capable of getting access to food assistance. These are some other additional resources that we can put up in the chat, but we wanted to highlight them here. And these were just the references for the things I cited. And on that note, I will stop sharing. Josh, do you want to take it away?
Great. And I believe that the slide deck will be available afterward with the resources and our contact information. Thanks so much, Nipa. That was great. So I want to talk about recognizing best practices and effective strategies. And Nipa mentioned that the VA system started doing food insecurity screenings, I believe, in 2018. So let's think about that for a minute. The VA system only started doing food insecurity screenings in 2018. So we've got a lot of catch-up work to do, Because if we're not asking the question, and we're not asking the question correctly, then we don't know who may be food insecure, and then we don't know how to effectively respond. I think one of the most important resources that is available, where there's a lot of work to do, is connecting food insecure veterans to SNAP. While there are food pantries that are on numerous VA campuses, that's great for emergency needs, but it really doesn't deal with the systemic issue. And if we're not connecting veterans who are struggling to put food on the table with a program like SNAP that has the capacity to regularly be there in times of need and to respond when there are times of greater need, we're not doing all that we can to help those veterans. So want to impress upon everybody here and challenge you to think about ways to better connect veterans in your community with SNAP. As I mentioned, only about 1 in 3 veterans who are eligible for the program are participating. So there's a very strong need to make that connection. And we know that the charitable sector just doesn't have the capacity to fully meet the needs of hunger for veterans in their community or for the communities as a whole, nor should the charitable sector be expected to. So in thinking about ways to connect veterans to SNAP, one of the most important things to do is to be responsive right at the time. So when food insecurity screenings are happening and a veteran is determined to be potentially food insecure, to make sure to share information at that moment about SNAP, and ideally, if eligibility screening is possible or application assistance is possible on site at that moment, that maximizes the chance that you'll be able to make that connection. If instead it's just a cold handoff, handing them a brochure and telling them, well, you'll have to make an appointment at another time at another location, the likelihood that veteran is going to follow through diminishes significantly. One of the most effective strategies is peer-to-peer outreach. And so recognizing veterans who are part of your existing networks who might be willing to volunteer their time and reach out to other veterans, that's going to help tremendously to break down some of that stigma and to address that military and veteran culture where there's a reluctance to seek help, a reluctance to acknowledge that you might be struggling. When you hear from a trusted source from another veteran, from that peer contact, there's a level of confidence and trust that helps tremendously. And we know that food insecurity in the veteran population is in part a result of that high level of stigma, of shame, embarrassment, and reluctance to seek help. So the source of information is so important. And what's also critical, if you don't have veterans in your network who can do that peer-to-peer kind of outreach, make sure that the people who are on the front lines who are doing that outreach really listen. It's not just about the information that gets shared, but it's listening to understand what are the concerns of the veteran. It might be something very different than the rest of the population that you're dealing with. And so try to be responsive to those unique needs. We know in the veteran population that there's a much higher rate of trauma, whether it's military sexual trauma or PTSD. And some of those experiences may lead to a distrust of government agencies or just a wariness that you want to listen for and think about ways to break through. In thinking about outreach efforts, center the lived experiences of veterans. Don't design outreach and programmatic initiatives in abstract. Involve veterans in your community in designing them. Make sure that they're responsive to the needs, to reaching veterans where they are. Having input and participation by the veteran community is really important. And as Nipa mentioned, food insecurity rates vary by different era of service and different backgrounds of veterans. So think about the diversity of veterans in your community and try and be inclusive in those that you engage as well. Now, in addition to making connections to SNAP, there is a lot more that we can do on the policy front to better connect veterans with available resources. And I'm going to turn things over to Scott now, who's going to talk about both legislation, policies, and regulations in ways that as advocates we can better support veterans and connecting them with available help.
Thanks so much, Josh. Appreciate that. And before I talk a little bit about some of the opportunities, to do that, make changes with, in the legislatively, regulatory, and policy-wise that are coming up, and of course we have a new administration. And as a veteran, I just want to echo and thank you very much for your knowledgeable words about communicating to vets, meeting them where they're at, understanding how to listen, understanding how to include them. One of the most amazing things that it's the military community and the veterans community is certainly the largest fraternity, sorority, in this country without a doubt. And when you meet a veteran, you don't even need to, most of the time, you don't even need to say, hey, I served. It's just you have that look and So I just want to thank Josh for bringing attention to that, and Nipa for your wonderful presentation with the need for data and showing that, the real challenge, especially as we have younger veterans, coming out, and many of our younger veterans have families and are going to be facing challenges, with PTSD, with loss of limb, and all manner of other disabilities that they're going to need our assistance and support for a long time. And I think, we have a great opportunity to do that. So just a couple things. I also, looking at the federal programs, obviously, there are many veterans programs. As a veteran, when you are discharged, I will just give you a little story. I was discharged in 1988. What I was told when I got out was, Scott, make sure you go ahead and apply at the post office for a job, and then make sure you file for unemployment. It's been great. And oh, by the way, make sure you got your VA home loan activity as well. That literally was it. I mean, I wasn't given much else past that. A plane ticket back from Okinawa, Japan to Travis Air Force Base, which was nice, and that was about it. So what my one point is that I think there's an opportunity with the TAPS program, Transition Assistance Program, that DOD and VA work on. So if you are a transitioning veteran, as Josh mentioned, the key is connecting our veterans with the information. It's not telling them to sign up, it's giving them the information to make that choice for themselves and making it the way they would like to apply for it. So I think a strong look at the Transition Assistance Program and ensuring that we have not only veterans benefits in there, but also non-veteran, if you will, designated benefits in federal programs such as
I think we lost Scott.
Yeah, but just to kind of go off of what Scott was saying, and please, we want this to be an interactive conversation. But I've spoken to probably 50 or 60 veterans from different walks of life, and after I do my interviews with them, the last question I ask them, the next to last question I ask them is, so if there was just one thing we could do for you, what would it be? And almost always they will say, help me find my resources, connect me with my resources. We have to research where we can go for help. We have to research the VA. We have to research the community. And a lot of times it's through serendipity that they find help. There's a story of one of the veterans, and I called her yesterday just to make sure that I had her permission to share her story, but I won't share her name, so I guess it kind of doesn't matter. But she was pregnant, and she's an Army veteran. She was pregnant, had her young daughter with her, and they're on a city bus. And at this point, she's been homeless for a while. She's been couch surfing along with her daughter. And there's this other man, and just like Scott said, you can like look at a veteran and tell that they're a veteran. There's this man sitting across from her on the bus, and he said, "Are you a veteran?" And she said, "Yes." And he said, "You look hungry." And she said, "Yes." So he reached in and gave her $5. Actually, I think he gave the daughter $5. And then he talked to this veteran and asked her if she had ever heard of the vet center. And she hadn't. And so he gave her instructions on how to get there by bus. And she went there that same day. And she said that was the moment that her life changed. At that moment, she was connected with a case manager who got her a housing voucher, helped her find an apartment to sleep in that night. Also gave her a list of food pantries, of which she spent the next 3 hours trying to go through to see which one she could actually physically walk to that was open and would have food available to her and her daughter. And but she eventually found one, and she got food the next day. And then she also started a SNAP application with the case manager. And so within, I think she said 7 days or so, she had a SNAP voucher in her hand. But that was the turning point in her life. And that turning point wouldn't have happened had she not been on that bus at that moment and that man wasn't on the bus with her. So the serendipitous nature of sometimes how our veterans find assistance is, for lack of a better word, ridiculous. And there needs to be a more systematic way of assisting them. When they serve us, they're not doing it through serendipitous manners.
So, Nipa, that's a great point. And just to add to that, we shouldn't depend on serendipity for our veterans to be able to get the resources they need. And while there's a lot of information about many resources out there for veterans, unfortunately, food resources, nutrition assistance, isn't always part of the information that's provided. Scott mentioned, and he's working to reconnect right now, he mentioned the TAP program, the Transition Assistance Program, and we've been pushing for a long time for information about SNAP and WIC to be included in that TAP resource collection of information, and it still is not to this date. So we need to do a better job of integrating to make sure that USDA nutrition program information is available to veterans. I want to just mention a couple of resources to you, and we'll try and share these in the chat as well. MAZON was really pleased to partner with Psych Armor Institute to create a video training course, a quick 14-minute basic training about food insecurity in veterans, to better for service providers who work with veterans to better understand some of the unique challenges of veteran food insecurity and to familiarize them with SNAP. So that was one of the resources on the slide deck that Nipa shared. So you'll have a link to that. I'd encourage you to watch that because it, again, reinforces some of the unique challenges that veterans face. I mentioned before about peer-to-peer outreach and the importance of working with veterans in your community. And if you aren't currently engaged with veterans in your community, there are ways that you can reach out either through existing veteran service organizations. Every state has a veteran service office, and we'll put in the chat a way to find the state veteran commission or resource offices so that you can make a connection there. And then Nipa, I was wondering if maybe you can talk a little bit about the ETS-SP, the Expiration of Term of Service Sponsorship Program, as an additional resource.
Yeah, and I posted some of the resources that Josh already alluded to in our chat, and I just now posted a link to the ETS sponsorship program. But this is a new initiative being rolled out by the VA in partnership with a private organization, a nonprofit organization called the ETS sponsorship program. ETS stands for End of Term of Service. And what they're trying to do is basically connect transitioning service members, so somebody who's got a discharge date. And as they're walking into their TAPS class, ETS has a table set up, and they ask the soon-to-be veteran if they want to have a coach or a sponsor is what they call them, but basically somebody, a buddy, that will be there in their home state or home city when they discharge from active duty. And so this is going to hopefully reduce some of those transition stressors, because now you've got somebody on the outside ready to, for lack of a better word, receive you and help you get reacclimated to civilian life. if you need help with putting together your CV or your resume, finding those programs in your area, those veteran service organizations that can help with employment. And my what I'm hoping for is that this is also going to prevent those transitioning service members from experiencing food insecurity in the first place, because ideally this will help with their transition, will get them situated in a place where they are financially secure and their housing is stable, so they don't experience those drops in stability. So anybody can sign up to be an ETS sponsor. If you go to the link that I shared, you can click on I want to help button, and it will take you to a little intake form, and that's kind of how you sign up to be a sponsor. And then there's some steps after that. There is a training program, a short one that they have all their sponsors go through to make sure that you're able to provide the types of help that the veterans need, but you don't need to be a veteran yourself to do it.
Nipa, we have a question in the chat. I think maybe you might be able to answer. And let me just say a couple words about questions. If any of you have questions, feel free to put those in the chat, or if you raise your hand, there should be a hand icon at the bottom. We'd like to hear from you if there are particular challenges that you're facing in your communities, particular issues that you've seen. Wanted to note, and I'll let Eva answer this in just a second, the question in the chat. Scott mentioned the need for assistance during transition. And one idea that's been proposed and that MAZON is putting some effort into is the idea of a transitional benefit that could be targeted toward junior enlisted service members who are getting ready to leave military service. Some type of way of saying thank you that would also help with the food needs during the first few months when a veteran may be particularly vulnerable as they're trying to find work in the civilian world. So that's something that we're looking at. Also wanted to note that some states have a veteran farmers market nutrition program. It's kind of like a double up food box kind of program where there are vouchers to incentivize the purchase of healthy fresh fruits and vegetables at farmers markets. In some places that's geared toward veterans who have diet-related conditions. In other places it's for low-income veterans, but that's something else. And also just want to note that there's a connection, even though the issues for active duty military families are different than those for veterans. We know that there's a continuity of experience. And that military families struggle with food insecurity as well. And there is an effort to try and provide assistance to currently serving families who are prevented from qualifying for SNAP because of a quirk in the law. I'll put information to an action alert if you're interested in learning more. This is from MAZON, something that we've been working on. So I just want to be clear, it's not not a USDA or VA kind of initiative, but in that continuity of experience, we sadly, food insecurity is something that both for currently serving families and veterans is an issue. And then Nipa, maybe if you want to speak to the question about data.
Yeah, so I think we mentioned a couple of times that the data on food insecurity in veterans is a bit limited right now. So in terms of, do we know geographically where there's differences in distribution or variance? I can't answer that one. As far as I know, unless there's a way to do that by zip code with the current population survey, and I don't think anybody has done that. And then the other one, it just moved on my screen. I think you said race. Again, the race is kind of falling in line with what we see nationally. So veterans of African American, Hispanic backgrounds do seem to have a slightly increased risk factor compared to those who are Caucasian. And that's using data that I've seen on the current population surveys and Manhattan surveys.
Hey, Josh. Scott Carter back here. My apologies, everybody from the state of Maine. Certainly not blaming it for my lack of technology here. but I'm sure Josh covered a lot of issues. Josh, did you happen to talk a little bit, just real quick? I wanted to mention, we've been talking SNAP a lot, but I wanted to mention NAP and the territories. Did you speak a little bit about that? That, you know, some of the challenges in the territories because they're on NAP, you know, their veterans have even you know, a little bit of more challenge. But did you happen to mention any of that?
We didn't, and I know that there's a very large veteran population in Puerto Rico, so please go ahead.
Yeah, just want to let folks know as well that SNAP is administered to the states and the territories. However, some are currently on block grants. CNMI, the Commonwealth of Northern Mariana Islands, the Commonwealth of Puerto Rico, and I believe American Samoa are all on block grants as it related to SNAP. And so they are on what's called NAP. And so, again, many veterans in their communities, and the issue with NAP is during a disaster or other type of activities, being on the block grant, there could be some challenges, you know, down the road, if benefits need to be cut and things of that nature. So, you know, the challenges that the territories have in balancing, you know, providing benefits and what have you is again, just another challenge. I know the CNMI just signed an MOU with USDA FNS, and I know the leadership at FNS worked real hard, and the MOU has given some parity there, not on SNAP, the program, but funds and enough to put it on parity. So the recognition is there, but I just wanted to mention that. And also mention the ideas of, again, just getting creative, the on-site application. Many states, I don't know if you mentioned, Josh, but, you know, there are calculators out there that, you know, many veterans, kind of like seniors, you know, hey, I don't want to take anybody else's benefits. I don't really need that. It's not going to be much anyway. There are a lot of states that you can see what benefit levels you're going to have. I've known examples of working with seniors as an example, who they thought they might get $15, you know, $20, $30, $40. They end up getting $115, $150 and what have you, enough to pay another electric bill, enough for some medicine, or in a veteran's family, situation, enough to buy some school clothes. So I just want to throw that out there. And you mentioned the farmers market, so I appreciate that. And I'm sure you had a shout out to our a dear late friend Gus Schumacher as well on that. And so that's all. And welcome any questions. And thank you, Julia, for that information as well. Thanks.
And it looks like there's a question. I work at the state level dealing with senior hunger, and I was curious if there are any specific resources, initiatives for seniors who are veterans. So there certainly are some senior specific resources. I'm not aware of anything specific for seniors who are veterans other than there is the Senior Farmers Market Nutrition Program, and then in a few places the Veteran Farmers Market Nutrition Program. There are some focus programs for seniors. So just as a reminder, there is the Meals on Wheels program that involves the federal government, but often with Meals on Wheels agencies at the state and local level. There's also the Commodity Supplemental Food Program, which is I believe now exclusively a commodity buy.
That's correct. That's correct, Josh. It is a senior-only program. The 2 farm bills ago ensured that. Yeah, Josh, I want to as well. I believe there's a friend who's in the session as well. I just want to maybe she could put her information in chat in here. Our good friend Nicole Berta is here from AARP in the session. So I don't know that Nicole has any information. I'm not aware of any specific veteran seniors programs, Josh, but there are a lot of senior programs that are certainly out there that can benefit our senior veterans. And so I certainly don't want to put Nicole on the spot, but maybe if she could put her contact information in there, maybe she could share some information. So thanks. Yeah, because it takes all of us.
And just one additional commodity program wanted to mention, because this is the population that serves at the highest number, highest rate of any demographic group in the country, and that's Native Americans. And there is also a separate federal program, the Food Distribution Program on Indian reservations, that serves a large number of Native American seniors. And again, there's a significant Native American veteran population, so that's another resource. So Nicole added something in the chat, and I'm going to post about the Psych Armor Institute link in the chat right now. And then, was there another question about data, Nipa?
No, but somebody did share, Alina shared information about the urban footprint. And she wrote there that they provide age, veteran status, gender, and income. It looks like at the block level. And Alina, does that mean like block level, like by the city, or at the city level? It looks like there's another resource for data though, if whoever's looking for it.
Yeah, at the so we provide veteran data. So that could be age, race, gender, access to internet, healthcare, all of that, disability, and we overlay it at the census tract level, and then with further data at the block level. So you could see specific neighborhoods where these veterans, based on how you want to break up kind of the different groups, are food insecure, food insufficient, are at risk of eviction risk, foreclosure risk, because that's being proactive when we talk about homelessness. And we're also exploring the mental health component. I think that's the final piece of the puzzle. So we're speaking with various state and county agencies because we know there's a great need on that front. So we've been in this space just in terms of risk, resilience, support for a while now. I'm more than happy to share a one-on-one demo with anyone that wants to reach out to me, and I'll provide my email. And the last piece of the puzzle is we can overlay all that data with then custom points of interest. So whether you have housing assistance sites, shelters, food pantries, food banks, whatever it may be, we can overlay that so you can see, where these veterans can access those services.
I wanted to ask within our group, and Josh, if I may, are there other veterans that are in this chat or in this work session with us?
I think it's a great question, Nipa. Feel free to put in the chat if you are a veteran. And I just also want to add, I love the discussion. I really appreciate the resources that are being shared on the side in the chat. I think this is part of what we really need to, as folks working on this issue to do, is share that information and make these connections. So I appreciate that, and would welcome any veterans to share.
And I wanted to put a call out to folks in the audience. If there's anybody who's willing to share about successful efforts you've done in your community for identifying veterans, doing outreach, making those connections to SNAP. And one of the things that Nipa, Scott, and I have talked about is the importance of just asking the question to see if veteran that you're talking with might need some assistance, and how difficult that can be. But if you don't ask the question, then you can't find out how to help. So I'm curious if there have been effective strategies that any of you have used in doing screeners, in doing that outreach, in partnering with veteran service organizations in your communities. Any examples to highlight? Would welcome folks to share.
Excellent. Thank you, Eric.
And thank you for the information, Kelly, about the food distributions to areas where the VA is aware that heavily populated by veterans. We should note, and we've talked a lot about the VA, but not every veteran is connected to the VA system. In fact, it's less than half of all veterans receive care or services through the VA system. So when we're talking about connecting with veterans, we want to be mindful of reaching veterans who may be struggling, both those who are within the VA system and currently receiving care services, and those who are not. And those who are not engaged with the VA in some kind of way may be tougher to identify and to reach. And so a food distribution at a place where there may be a large gathering of veterans or where veterans gather might be a great way to do that. And that's a perfect opportunity to do SNAP outreach. So while a veteran may be going to get an emergency food box to help for that month, to have a conversation to talk about how SNAP could be a more lasting resource so that they might not have to come on a regular basis, and they might be able to boost their grocery budget and afford healthier food on a routine basis. So looking at those kind of opportunities where there are larger gatherings of veterans who might be in need, and thinking about ways to socialize the idea of SNAP and to take away some of that stigma and reluctance to seek help.
Hey, Josh, thank you for that. That makes great sense. Eric, appreciate you. Thanks for your service. I'm Blue as well, Air Force, appreciate you. I also just wanted to bring folks' attention next week on the 10th of November. I posted the House Ag Committee will be having a hearing on veterans and service members. Clearly, I think as Josh and Nipa, we can say two distinct challenges, two distinct groups. One, active duty, very different current life on how they live and the challenges they face versus our veterans. So real important hearing coming up. So would suggest that folks listen in and continually learn on the challenges and opportunities. So I know there's going to be some great witnesses there, a lot of great information being shared. So I encourage everybody to join that, and appreciate you, Eric.
And Julia, thanks for the note about county veteran service offices, and especially in rural areas. And that's something that's really important. We, unfortunately, when we talk about food insecurity, oftentimes there's a perception, and it's really a wrongful perception, but a perception that this is an, quote, urban issue. And I think that is often racially coded in terms of what people are trying to say about food insecurity. The truth is that food insecurity impacts every community, every state, every county across this country. And in fact, in rural areas, food insecurity is just as great, or sometimes even greater, than in larger urban areas. And we know that there's a very large rural population of veterans. USDA has some great programs about connecting veterans to careers in agriculture. Scott, your colleague Bill Ashton will appreciate that I'm giving him a plug here. So there's some great resources there. Julia, I'm wondering if you might be able to share either in the chat or to share just, what kind of resources are available through the county veteran service offices.
Yeah, so thanks. I didn't want to hijack your session, but this is something I've actually been working on a lot. So county veteran service officers connect veterans in their counties to services, right? So it could be social services, food assistance, but they tend to be a hub where veterans can go and figure out what benefits they have, and either as a veteran, as a citizen, or as, by age. And so I've done a lot of work with county veteran service officers, in particular in New York State. We're looking at doing an integrated system for the whole state, similar to America Serves, which I had posted before. But one of the things I found in talking to rural county veteran service officers is that they know who the veterans are, and they're often, pre-COVID, they're knocking on doors, making sure, checking in, making sure things are okay. When you go into their offices pre-COVID and starting to come back now, veterans will actually come and hang out and have coffee, and this is the hub. This is sort of their space where they go. And so if you're looking to do SNAP outreach with veterans in rural counties, starting with your county veteran service officer is a great place to start, just to understand who the veterans are in your county, and they're likely going to know the ones that are hungry or where to find them. So just a plug there, there's a National County Veteran Service Officers organization, or if you need help finding your CVSOs in your state, you can shoot me an email, and I'll drop my email in the chat again. But again, really critical resource, especially in those rural areas where you don't have high population, but people are really spread out. They're going to know where to look.
That's fantastic. Thank you so much. And unfortunately, it looks like we are out of time. Really appreciate the active chat and sharing resources. That's what we wanted, because we know the expertise rests with all of you as well, who are in the field doing this work. And I think there's a lot we can learn from each other. There's still a lot more work to do to close that participation gap in SNAP for veterans and make sure that we're really doing right by our veterans. That it's not an empty platitude about thanking them for their service, but we're really backing that up by being there as a country, as a community. And the anti-hunger community needs to step up, frankly, a little bit more in this space. And all of your participation here today is incredibly encouraging about that. So I don't know, Nipa, Scott, if you have any closing words?
Nipa, go ahead, please.
Oh, I was just going to say thank you all for attending and providing the information on the side as well, especially with COVID. It's been hard to interact and network, so this was an excellent way to do that.
Yeah, let me add my thanks as well, to the Alliance for the opportunity and the leadership to bring this, to everybody's attention, continuing. Josh, let me just thank you as well personally. I got to let you all know I've been working with MAZON and Josh for a long time on this issue. They are have really stepped up, not only in this area, but also with our active duty military. So I must have a shout out to my good friend and colleague. So thank you all again. This is, like Josh said, we got to have the information share. No one group or organization can do it, but I do believe we can do it together. As we continue to show leadership, that's really what's going to do it. So I thank you everybody for your help.
All right. I want to thank all of our speakers, Josh, Nipa, Scott. Y'all were fantastic. And thanks for everybody for participating in the chat with your questions. It was a really, really great session. So thank you all. Up next is a really short, slightly less than 15-minute break. And we're going to begin our next set of 4 workshop sessions, providing solutions, best practices, and toolkits you can start to utilize within your respective communities. Join one of these 4 sessions. To join one of these 4 sessions, click workshops in your navigation bar to the left of your screen. Make sure you view all 4 of the workshops being offered by clicking the arrow on the right, and then click enter the session. That concludes our workshop. To exit, please click the red phone icon at the bottom of your screen now and click leave. Have a great rest of your day, everybody.